So I'm going to talk about the clinical use of a 650 microsecond neodymium YAG laser for the management of acne across different severities of acne and different demographic groups. So a survey was sent out to 138 users of this particular laser. When 50 users responded, this was enough to allow statistical analysis. The additional answers were not accepted anymore. Of the 50 users, 46 were dermatologists. The survey entitled 26 different questions concerning the clinical utility, the efficacy, the patient satisfaction, and of course the post-treatment outcomes, and statistical analysis was done on these data. So first a little bit on the demographics, as well male as female patients were included, and all skin types. 50% were skin type 1 to 3, the other 50% was divided over skin type 4, 5, and 6. As well, teenage patients as adults with adult acne were included in the study. Almost more than 90% of the respondents have been treating acne for more than 10 years. So we had a population of doctors that have a lot of experience treating acne. Nearly half of the responders have treated more than 200 patients with this particular treatment modality. Oops, I think I went, yeah. And 90% of the responders had, with this particular laser, at least 2 or more years of experience. I already highlighted this slide. The median number of patients that were treated per week were 6.5, with a minimum of 1 and a maximum of 80 patients per week. The greatest number of the responders used this laser to treat moderate acne, followed by severe and mild acne. 44% of the responders state that after a single treatment, about 10 to 25% of the patient population showed response. This increased to 25 to 50% after 2 treatments, and even to 75 to 100% after 4 treatments. No improvement, being less than 10% of the patient population, was infrequent for nearly all of the responders. If we look at the reduction in lesion count, the treatment success defined as up to 80% reduction in lesion count was noted as well for mild, moderate, and severe acne. The patient satisfaction was similar also for the 3 different groups of acne. Compliance with the treatment was very high. There was a dropout of less than 10% of patients during the treatment. The discomfort was minimal, with a VAS score of about 2, and the tolerability even for the pain-sensitive teenage population was well tolerated. The side effects were minimal. We looked at edema, erythema, flare-ups, dryness, or itchiness. They were so minimal, with none being the most frequent response. And here you see some of the results. Patients get usually 4 to 5 treatments, and even after the last treatment, you see that there is further improvement with time. This is a skin type 2, a skin type 6, and also a dark skin type with nice response. There are other skin benefits using this laser for treatment of acne. 90% of the responders also reported improvement of the post-inflammatory hyperpigmentation, the post-inflammatory erythema, a slight improvement of the acne scars, a reduction in the skin oiliness, an improvement of the skin tone and the skin texture, and 90% of the patients, of the responders also reported that patients have mentioned a very positive changes in self-perception. So in conclusion, the 650 microsecond 1064 pulsed neodymium YAG laser is definitely a safe and efficacious treatment modality for the management of acne, as well mild, moderate, and severe in all skin types. Thank you for your attention.